programs to serve healthcare workers, patients, and their caregivers. Today, on the occasion of World Liver Day, we have a renowned gastroenterologist from Delhi, Dr. Vibhu Mittal. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Vibhu is a leading gastro in Delhi, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient centric care. He is currently associated with Max Super Specialty Hospital, Pratapganj, Delhi. Sir, we salute your dedication to spread awareness related to liver health. So now I invite Dr. Mittal to enlighten us on the topic. Over to you, sir.
Thank you, Mr. Lakan, for the kind introduction. Uh, Today, there is also a World Liver Day. This has been promoted by WHO for past few years to increase awareness regarding liver-related disorders. And for last few years, fatty liver is increasing, especially in Indian population, like anything. So today's session would be predominantly on understanding what exactly fatty liver means, fighting fatty liver. So let's start with first the basics. What exactly is liver? So where is it located? So if you place your hand on the right upper quadrant, right side of your abdomen, upper end, this is the place where liver is found. It is the second largest organ of the human body. It weighs more than a kg, is roughly around 1500 grams. And usually around 5% of the liver weight is fat. Usually it is pinkish brown in color, soft consistency, and highly vascular. Now, like to draw your attention to the point that around 5% of liver is usually fat. Your heart pumps blood, your kidney cleans your blood to form urine. In this way, it helps excrete certain products. But liver is a multifactorial organ in itself. It is involved in more than 40 metabolic processes. The processes are involved in not just producing bile, but it is involved in processing of nutrients. Uh, uh, it, it is responsible for producing all the cholesterol in our body. It is responsible in protein metabolism. uh, it also serves as a place where alcohol and many other medications are broken down. It regulates blood composition. It destroys old RBCs and detoxifies blood. So it's a very important organ which is doing multiple metabolic, excretory, anabolic pathways. Now, fatty liver in the liver means excess fat in the liver. So when the fat content increases beyond 5%, this technically is excess fat in the liver. And there are two predominant reasons for fat in the liver, excess fat in the liver. One is alcohol. And in today's talk, we'll not be talking about it, but it is a significant uh, uh, reason for liver related problems in itself. Today, we'll be talking more about non-alcoholic fatty liver disease, which is also now known as metabolic associated steatoliver disease. Uh, if you do not treat this, then in a certain subpopulation, this may progress into steatohepatitis, which means inflammation of the liver, which can then further result in permanent damage to liver and maybe cancers also. The commonest risk factor for development of steatohepatitis related to fatty liver related to without alcohol is excess body weight, that is obesity. It is also very frequently seen in individuals with diabetes, high cholesterol, etc. This is a rough estimate. World over, around 1 out of 4 adults would have NAFLD regardless of weight. So 25% of world population, and this data holds true for India, if at all. The prevalence of this in our country is increasing. 25% of world population have NAFLD, more than 60% diabetics, and 90% obese would have NAFLD. It is more common in males as compared to females, and in males, the progression to steatohepatitis and fibrosis, which is permanent damage to the liver, is even more. So this is how it goes. Healthy liver, if you increase the fat, it becomes fatty liver. If you decrease the fat in the body, so simultaneously decrease the fat in the liver as well, this may again go back to healthy liver. Then long-standing health fatty liver would result in development of inflammation, scarring, resulting in liver fibrosis, causing more liver cell injury, and this then becomes a irreversible problem, resulting in cirrhosis over a period of years. At this level, in colloquial terms, we say liver सख्त हो गया है. This may lead to then increased pressures in this system, causing portal hypertension and finally liver failure. So again, I've talked about this in the previous slides, but again, non-alcoholic fatty liver is just fatty accumulation in the liver. While when you say steatohepatitis, it means fat which is also causing inflammation, यानी कि सूजन and scarring, यानी कि permanent damage to the liver. Now, causes of NAFLD, we are again talked about is excess fat in the body and body's tendency to deposit it in the liver are the main reasons. So, excess fat is obesity, which may be related to food intake. Genetic background plays an important role. Metabolic syndrome, diabetes, visceral obesity, hypertension, or dyslipidemia, or excess cholesterol are all components of this. Being exposed to certain medications, the list is not very long, it's a small list, but the things which I like to draw your attention to is that is use of steroids, use of anabolic steroids, which is very commonly rampantly used by our young adults these days in gyms, etc., may contribute to this, and definitely physical inactivity. These are uh, these factors either alone or in combination results in non-alcoholic fatty liver disease. So again, if you are overweight or obese, it causes fat to accumulate in the liver. And when this increases over time and there develops inflammation, this may lead to NASH and scarring of the liver. There is also some association between fatty liver and the diabetes. It is bidirectional. So diabetes is associated with threefold increase in death due to cirrhosis and increased risk of NASH. And in individuals who have NAFLD and may not have diabetes, they would have higher chances of developing diabetes. So, if in my OPD I'm seeing a young adult who may be 20ish, has developed a fatty liver, is not diabetic till now, I'll be counseling him that see, your chances of developing diabetes are also more as compared to any of your peers by virtue of your being having fatty liver. Fatty liver does not have any symptoms. It would not cause any symptoms. Um, Even the non-specific symptoms of mild fatigue and discomfort would only develop when there would be significant inflammation. So it has to be understood and picked up on evaluation. If you have risk factors of developing fatty liver, that is obesity, um, decreased physical activity, lot of junk use, some amount of alcohol use, or use of anabolic steroids, genetic history, then you should get yourself tested for presence of fatty liver. It would be otherwise asymptomatic. Only in advanced situations where fatty liver has developed NASH and then fibrosis or advanced cirrhosis, in those situations, the patient may experience fatigue, nausea, buildup of fluid in the abdomen, confusions, decreased appetite, easy bruisability or bleeding from small cuts, unexplained weight loss, jaundice, etc. So, in early stages, fatty liver does not cause any symptoms. It can be a silent killer because progression of disease is very gradual. You would not even realize, and then one fine day, a patient would come to an develop something and come to an OPD saying that only I have symptoms only for past 1 month, but it would have been there for last so many years to reach to a situation where patient starts experiencing jaundice or fluid in the abdomen, etc., etc. So we need to be aware of how to identify this. There are a combination of tests, blood tests, ultrasound, fibroscan, biopsies, etc. So most common blood tests are LFT, liver function tests. And in that, SGPT and SGOT, also known as ALT and AST, are of significant importance. They are not very specific for development of for fatty liver all only. That is, by this I mean to say, it is not as if AST and ALT are raised, this is a diagnosis of fatty liver, but it is associated with disease progression. So even a borderline raised values of say normal value being taken here as 30 and levels of 40, 45, 50 over a period of time can result in progressive liver damage. It does not mean that a normal ALT cannot have progressive disease, but the chances would be less. And repeatedly normal ALT is a situation where progressive liver damage may be less common. It is a useful tool of um, reviewing these patients at a regular interval. There are other group of tests like FIB4 and NFS, which are scoring methods established to diagnose liver injury better than ALT and AST alone. Online tools are available also, but they're not commonly used in routine practice. What is commonly used is non-invasive diagnosis of NAFLD is ultrasound. It is readily available, economic, and it is the reason for most accidental diagnosis of NAFLD. The problem is that it only picks up NAFLD if fat is around 25%, when normal being 5%. And it cannot differentiate fat from fibrosis, but still it is a useful tool because it will pick up incidental findings. This is something which we more commonly use these days. Also to confirm your ultrasound findings, and in high risk cases where chances of finding fatty liver would be more. Uh, Also commonly known as a fibroscan. This is transient elastography. There are two components which we are diagnosing with this. One is this cap. This is a measure of the amount of fat in the body, in the liver, and this is LSM, which is a measure of developing fibrosis or uh, in other words, permanent damage to the liver. So this useful tool, which is non-invasive also, can also help us differentiate fibrosis, which would mean advanced liver damage. It works on the principles of transient elastography. I've already talked about LSM and CAP values here. LSM tells you about degree of fibrosis. CAP indicates degree of steatosis. MRI can also pick this up. This is a specialized test, not commonly available in India these days, and is also not very routinely used. It is used usually in research settings only. Fibroscan is what suffices most of the times. Liver biopsy is the gold standard, in which using a small needle, a small piece of liver is taken and sent for evaluation. It is again not commonly used to diagnose to diagnose fatty liver, but in situations where there can be multiple diagnoses, this can be used. So we have already talked about this to some extent. NAFLD is only fatty liver. If you add inflammation, Sujan to it, it becomes NASH. And with progressive NASH, there is a situation where the patient would end up developing cirrhosis, which is hardening of liver. And after that, there would be development of either liver cancer or liver failure. Now, this process from NAFLD to decompensation or SCC, it takes usually years altogether. But unfortunately, initial period of so many years does not produce any symptoms. And the patient would have symptoms only in this situation. Not everybody would develop NAFLD to this cirrhosis and decompensation, but we do not know for certainty that a particular patient would not. So it is always better to act before it's too late. It is a more serious form of NAFLD NASH in which you have scarring of liver. and it leads to cirrhosis or liver cancer. In next few slides, we'll be talking about how to prevent NAFLD from developing, or if it has developed, how to prevent its progression in initial stages. The in the initial stages, it is the lifestyle predominantly which is of most importance. It is diet and exercise with some lifestyle modification in the form of avoidance, strict avoidance of alcohol in any form, as well as tobacco. So the medications are also available now. Uh, for initial management of fatty liver, what is needed is to since there is excess fat, you need to lose that excess fat. So it is a combination of hypocaloric diet with moderate intensity exercise, which has the best likelihood of sustained weight loss. Uh, a usual 1200 to 1400 kilocalorie diet would be needed for a usual adult to start losing some weight. This can be started with proper program under supervision of a dietitian and moderate intensity exercise. The aim is to lose at least 10% of the weight if you're an obese individual. If you can lose 10% of weight of your body weight, the chances of improvement in the liver histopathology is also there. And this has been shown to be better than any of the available drugs. Even weight loss to the tune of 3 to 5% body weight also help improve fatty liver. Weight loss is the gold standard. You need to do it. This is what I was talking about. If more than 10% of weight loss is achieved, even fibrosis, the permanent change may be uh, uh, resolved or um improved in a significant minority of patients. This pyramid tells you the diet for healthy liver. It is not for diet for the only the healthy liver. It is diet for healthy body. It's not just for liver. It's also good for heart. Also, this is a healthy diet. So the Mediterranean diet is what has been recommended. But for our Indian North Indian patients, what is to be understood is uh, that lots of greens, lots of locally produced fruits and vegetables with decrease in the amount of usage of uh, sugar and fat, decrease in the amount of cereals also. Take adequate amount of proteins, but definitely avoid red meat and processed food in all forms. There are two types of exercises, aerobic exercise and resistance exercise. Both have their own place. Aerobic exercise would reduce the liver fat, maintain healthy weight, and improves cardiovascular conditioning. While resistance exercise, which is gymming, etc., it reduces liver inflammation, improves glucose absorption, insulin sensitivity, and improves the metabolic parameters with less energy consumption. Aerobic is definitely needed. Resistance would be most welcome if it can be added to aerobic exercise. Apart from this, uh, healthy lifestyle, which so apart from exercise, enough sleep, decreased stress, enough and well balanced diet with enough of vitamins and minerals, regular medical checkups as per your general medical condition, small frequent meals, and lower your sugar intake. Pharmacological medications are now also available. Pioglitazone, vitamin E had some limitations, but have been there for past so many years. Saroglitazar is now a very safe and good medication and is being used for patients who have uh, uh, NAFLD with NASH. All the medications are for advanced NAFLD when you have, apart from fat, inflammation or early fibrosis also. There is no medication which can replace weight loss in situations where there is fatty liver. So to summarize, the tips is limit the intake of saturated fat and trans fat, eat a balanced diet, limit the consumption of refined carbs, maintain a healthy weight. Smoking and alcohol should be avoided, exercise regularly, and take medications as prescribed. It is important to treat simultaneously associated conditions like diabetes, hypertension, dyslipidemia, if any. So that is all from my side today. Uh, Like to love your liver. Take care of yourself. Thank you.
Thank you so much, sir, for this wonderful and enlightening talk. So, with your permission, I would like to take some questions from the
Definitely.
audience.
Most welcome.
Uh, so, we have one question that which diet we should follow if we have NASH?
So if we have NASH, we need to predominant is hypocaloric diet. Reduce your calories, maintain adequate protein intake. What does this mean is reduce your content of your sugars in any form, either direct sugars or indirect sugars in the form of sweetened drinks, etc. Reduce the intake of saturated fat. um, Reduce refined carbs, bread, मैदा, ये सब कम करना है. Even carbs per se have to be overall reduced. Roti, chawal, dalia, khichdi, all forms of carbohydrate would have to be reduced if we need to go to a hypocaloric diet, and maintaining the adequate amount of protein. It should not, as if with this weight loss diet, one should not end up with a low protein diet, which would result in muscle loss, which we don't want. Adequate amount of fresh fruits and vegetables, salads are most welcome in this diet.
The next question is when to visit a doctor?
So I'll say if you have risk factors for development of fatty liver, you should get yourself tested and take a consult. The risk factors would be if your weight is more than what it should be, if you have lifestyle which involves less of physical activity, uh, diabetics, patients with high cholesterol, patients in individuals in whose first degree relatives, that is parents or siblings, brothers and sisters, have history of liver disease, and individuals who consume alcohol. All of them should get their routine parameters and ultrasound done. And if they have fatty liver or increase in SGOT, SGPT, they should definitely visit a doctor. By the time symptoms come, if you are going to wait for the symptoms, then it is usually advanced fatty liver.
Thank you, sir, for this insight. On behalf of NASH 24/7, I thank Dr. Vibhu Mittal for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, I think it is equally important for people affected by fatty liver to regularly visit doctors and continue medications. With careful observation and precautions, it is possible to obtain control on the disease. So I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir.
Thank you.